What is diagnosis?
Coma. Coma.
15.
Coma, yes, I know, but what is the cause?
High hypertension.
Yes.
Cardiac problem.
Hypovolemic shock. Why blood pressure is 200 by 100?
Sir, BP raised होगा.
Blood pressure is
Compensatory.
hypovolemic 200 by 100.
Hemorrhage भी होगा.
Stroke, very good. So then why stroke? Because 80-year-old men, risk factor, hypertension, risk factor, sudden onset, and blood pressure is more than 200 by 100. So the diagnosis of and bilateral plantar earthquake is the sign of the upper motor neuron ileum. So the scenario of the stroke. Okay. Second, 40-year-old boy admitted in medical ward 3 with complaint of altered behavior for last 3 days. On examination, abdomen distended and spleen enlarged. Investigation shows anti-HCG positive. Liver failure.
Hepatic encephalopathy.
Very good. Why hepatic encephalopathy?
Encephalopathy.
Because of hepatitis and other features.
Abdomen distended and spleen enlarged.
Spleen is enlarged and abdomen distended. Why abdomen distended? Due to the ascites. So this is another cause of the loss of consciousness. Okay, hepatic encephalopathy. 20-year-old girl came in emergency with severe abdominal pain and loss of consciousness. On examination, rapid breathing, blood pressure 90/60, GCS is 25/15, and blood sugar is 400. What is diagnosis?
Diabetic ketoacidosis.
Diabetic ketoacidosis.
Diabetic
Yes, why
ketoacidosis.
diabetic ketoacidosis?
Blood sugar is
Blood
400.
sugar is
Breathing.
400. Okay, and why rapid breathing?
Because of acidosis.
Acidosis.
This is acidotic breathing. So diagnosis the diabetic ketoacidosis. And final scenario, 50-year-old female, non-case of diabetes and hypertension, complaining of the urinary retention and shortness of breath. On examination, she is drowsy and acidotic and edema present and chest is completely clear. What is?
Uremia, kidney failure.
Yes, so the reason of unconsciousness is the renal failure. So in all scenarios, clues are present. Okay, like
400.
400 sugar, like
Abdomen
spleen
distended.
positive. So every scenario or every case you should focus, and only on the basis of the one side you should be the diagnose the reason of the unconsciousness. Okay, so topic is unconsciousness and how to approach to the unconscious patient in every ward, like medical ward or surgical ward. What is consciousness? State of awareness of self and environment with ability to respond appropriately to stimuli result from the arousal and awareness. Two factors are responsible for the consciousness. One is the arousal and second is the awareness. So two systems are responsible for the consciousness. One is the ascending reticular activating system. It is present into the brainstem and pons, and second is the cerebral cortex. So in any patient has injury of the cerebral cortex or the brainstem or pons, patient may be unconscious. So two systems are responsible for the consciousness. One is the reticular activating system and second is the cerebral cortex. Okay, these are the different stages of the unconsciousness. So last stage is the coma. What is coma? State of unarousable unconsciousness due to the damage of the reticular activating system or extensive bilateral cortical damage. Second is the lethargic, mild reduction in the alertness. We are called the mild drowsiness. Patient is drowsy when you are given the painful stimuli, patient is conscious. Stuporous, deep sleep, patient can be aroused only by the vagus and repetitive stimulation. Return to the deep sleep when to the continuous to not stimulated. So you are given the painful stimuli, patient is conscious, and you are removed the painful stimuli, patient is unconscious. And finally, persistent vegetative state is the disorder of the consciousness in which the patient with severe brain damage or in the state of partial arousal rather than to the true awareness. So persistent vegetative state is occurred before the coma. So So on the basis of the stages, the first stage one is the lethargic, second stage is the stupor, third is the persistent vegetative state, and finally is the coma. Okay, classification of unconsciousness, classification of coma. Coma without focal signs or mechanism. What is focal sign?
Hemiplegia, weakness, hemiplegia,
Sorry?
hemiplegia, limb weakness.
Very good. So focal signs like motor weakness, monoplegia or hemiplegia, speech impairment, cranial nerve palsy. So these symptoms are collectively we are called focal neurological signs. And what is meningism?
Sign that present due to meningitis.
Yes, the meningism are signs of the meningism are the neck stiffness, curling sign or Brudzinski sign. So patient unconscious with no focal sign and no meningism. Most common diagnosis or TD is the hypoxic ischemic injury, metabolic like hyponatremia, hypokalemia, hypoglycemia, toxic cause and post-ictal cause. So in these conditions there is no any focal sign or there is no meningitis or signs of meningeal irritation is positive. Second is the coma with meningism. If patient is unconscious along with neck stiffness and cardiac sign is positive. Two causes. One is the meningitis and second is the subarachnoid hemorrhage. What is the differentiating point between the meningitis and subarachnoid hemorrhage?
Neck
Stiffness.
neck stiffness.
Neck stiffness is present in both conditions. So neck stiffness is the signs of meningeal irritation. In which condition headache is present?
Meningitis.
Very good. In subarachnoid hemorrhage, the most common symptom is the severe headache, worsening headache of life, thunderclap headache. And what happens in meningitis? Fever with alteration of consciousness. So in one condition is a headache and other condition is a fever. And third is the coma with focal sign. If the patient is unconscious and you are given the painful stimuli, patient is moved on the one side of the body. So we are called the focal sign. What are the causes? Stroke, infarction, hemorrhage, brain abscess, tumor, and sometimes hypoglycemia can present like stroke. So this is the classification of the unconscious patient. Yes. Post-ictal after epileptic seizures. Ictal means during seizures. Pre-ictal means before seizure. And post-ictal means after seizure. So this is the classification of unconscious patient. Patient is unconscious with no focal sign or meningism. Patient is unconscious with signs of meningeal irritation are positive, and patient is unconscious with focal neurological signs like unconscious with hemiplegia, unconscious with cranial nerve palsy. Okay, causes of the unconsciousness classified related with the brain, cerebral, and intracranial causes, medication overdose, drug abuser, carbon monoxide poisoning, hypothermia, heat stroke, hepatic failure, renal failure and cardiac failure, electrolyte imbalance like hyponatremia, hypernatremia, hypoglycemia and hyperglycemia, endocrine disorders like pain, hypopituitarism and adrenal insufficiency. So what are the causes related with the brain? Traumatic brain injury, vascular brain injury like stroke, infections, hydrocephalus, raised intracranial pressure due to any reason, status epilepticus, hypoxic damage and malignancies or brain tumors. Other causes we have discussed. Okay, history is very important in unconscious patient. History obtained from the relative because patient is unconscious. So eyewitness history or relative history is very important. So history of trauma, history of drug overdose, history of insect bite, history of fever, and the onset. The unconsciousness is the sudden onset or the gradual onset. Any history of the psychiatric illness, the patient is attempt the suicidal thoughts or suicidal drugs. Exposure to hot, not is the spelling mistake, hot environment like heat stroke, risk factors like hypertension, think of the stroke, diabetes mellitus, think of stroke, smoking, think of stroke. Fits, tongue-tied, urinary incontinence, and exposure to pesticides. So history is very important On the basis of history, the diagnosis is very easy. Okay, general physical examination. If you are examine the patient, if the patient is increased temperature, think of infection, think of heat stroke, and think of malignant hyperthermia. What is malignant hyperthermia?
Uh,
Yes, side effect of. Very good. So in malignant hyperthermia, the temperature is raised more than 110. And the reason is the overdose of the succinylcholine. So malignant hyperthermia is the complication of the anesthetic drugs. Okay. If the patient temperature is decreased, hypothermia, and patient is unconscious, what are possibilities? Drugs, neuropathy, in sepsis may be hyperthermia, in sepsis may be hypothermia, and finally uremia. In these conditions, patient is hypothermia. Pulse rate is increased and patient is unconscious. Think of anemia, cardiac disease, and hypotension. Patient is unconscious and pulse is decreased, which is called bradycardia, raised intracranial pressure. In raised intracranial pressure, blood pressure is increased and pulse is decreased. So we are called the Cushing response. Okay? And the second condition of the pulse is decreased is the heart block. Okay, if the patient blood pressure is raised, overall two conditions. The first condition is the hypertension, and the second condition is the raised intracranial pressure if the patient is unconscious. And what is the reason of the decreased blood pressure is the shock, hypovolemic, cardiogenic or septic shock. So general physical examination is very helpful for the identification, the cause of the unconsciousness. Okay, respiration. The pattern of respiration is also very helpful. If the slow and shallow breath, think of drug intoxication. If deep, rapid respiration, think of metabolic acidosis. If periodic respiration, think of cardiac failure or brainstem lesion. If rapid, shallow respiration, think of the uremic or diabetic ketoacidosis. Okay, the smell of the breathing is very important, which are helpful for the patient is alcoholic unconsciousness, ketones unconsciousness, hepatic or renal failure. Cyanosis and patient is unconscious, think of the respiratory failure. Anemia and patient is unconscious, think of the blood loss or chronic disorder. Edema with unconsciousness, think of the renal failure, heart failure and hepatic failure. Skin lesions with unconsciousness, think of HIV, skin pigmentation or drug reactions. Lymphadenopathy and patient is unconscious, think of the tuberculosis, malignancy and sometimes leprosy. So on the basis of general physical examination, it is very helpful for the diagnosis of the unconsciousness. Okay. Neurological examination. Neurological examination is slightly different if the patient is conscious or patient is unconscious. The sequence of neurological examination if the patient is conscious start from the higher mental function, orientation, time, place and person, cranial nerves, motor examination, gait assessment, sensory examination, cerebellar examination, dorsal column and finally signs of meningeal irritation. But if the patient is unconscious, examination start from the Glasgow Coma scale, examination of pupil, eye deviation, fundoscopy, corneal reflex, facial asymmetry, motor examination and signs of meningeal irritation. In motor examination only power is not assessed, otherwise complete motor examination is possible in patient in the unconscious. Okay, neurological assessment. Assessment of consciousness with the help of the Glasgow Coma scale. Check for meningism. If the patient is unconscious, examination for the neck stiffness and examination of the curving hand. If the positive, think of meningitis or subarachnoid hemorrhage. If high grade fever, think of meningitis. If there is no fever, think of the subarachnoid hemorrhage. Fundoscopy. With the help of the fundoscope, papilloedema, which is the finding of the raised intracranial pressure, subhyaloid hemorrhage, retinopathy, which is the finding of the subarachnoid hemorrhage. Examination of pupil is very important in unconscious patient. If the unilateral fixed dilated pupil, think of the third nerve palsy. And where is the layer?
Oculomotor.
Brain stem, midbrain. Where is the nuclei of the third nerve present into the midbrain. So patient is unilateral dilated pupil, think of the third nerve palsy. If bilateral fixed dilated pupil, think of the brain stem damage. Midpoint fixed pupil, think of the midbrain layer. Small pinpoint pupil layer into the pons, there is a spelling mistake. Small reactive pupil layer into the thalamus. So on the basis of the pupillary examination, you are identifying the reason of the unconsciousness. Eye deviation, conjugated lateral deviation, patient in the ipsilateral frontal lobe or brainstem layer. Disconjugated eyes means one eyeball is deviated to the other side and other eyeball is deviated to the other side. So we are called the disconjugated eye movement in unconscious patient. Think of the third, fourth or sixth nerve palsy. Okay, corneal reflex is very important. If the loss of corneal reflex, two possibilities. Patient is a trigeminal neuropathy or there is a brain death. Facial asymmetry, when you are given the painful stimuli, there is the absence of nasolabial fold, which is helpful for the seventh nerve palsy examination, motor examination, bulk, tone, and reflexes. Abdominal examination, if the patient is unconscious and hepatomegaly and splenomegaly, think of the liver disease, and lymphadenopathy, think of the tuberculosis or malignancies. Cardiac examination, and finally respiratory examination. Okay, some topics we have covered. The first condition is the subarachnoid hemorrhage, which is the one of the common reasons of the unconsciousness. What is the cause of the subarachnoid hemorrhage? Barium aneurysm rupture, trauma and warfare and overdose. What are the common symptoms? The most common symptom of subarachnoid hemorrhage is the headache, worsening headache of life, vomiting and altered level of consciousness, neck stiffness is present. Common investigation, CT scan brain, lumbar puncture and CT angiography to identify the aneurysm formation. Status epilepticus. What is status epilepticus?
Between two seizures unconscious.
Normal duration of the single seizure is the less than 5 minutes. If the seizures continue more than 5 minutes, think of status epilepticus. And the other definition, if the patient is 2 or more seizures within 5 minutes without the person returning to the normal between them. Risk factors of the status epilepticus, the patient is already epileptic and patient is developed fever, CNS infection, toxicity and space occupied lesion. Okay, we are seeing some CT scans and if the patient is unconscious. So this is a CT scan brain and you are seeing these are the black color worm-like structures. These are called sulci gyri. These are normally present, but if patient is a cerebral edema due to the unconsciousness, there is a loss of completely sulci gyri. So if the patient is unconscious and you are advised a CT scan and CT scan show there is a loss of sulci gyri, then think of the cerebral edema. Okay, this is another CT scan. The patient is unconscious and show there is the white pathology. The word used, if white pathology on CT scan, we are called hyperdense. If the black pathology, we are called hypodense. So this is the white pathology, it is indicate the hemorrhage. If the black pathology, then think of the infarction, tumor, abscess, infections. So this is a lens-shaped white pathology. This is a CT scan of the epidural hematoma. So in this patient, there is a history of trauma is present along with loss of sulci gyri. So patient is a epidural hematoma with cerebral edema and patient is unconscious. Other is the white shadow, so it is also hemorrhage, but the shape is changed. This is a lens shape and this is a crescent shape. So this is a subdural hematoma. Okay, and this is also white shape, so this is another hemorrhage. This is another white shadow, hypertension shadow. This is another cause of the unconsciousness in the hemorrhage. These are the small white shadows. These may be the hemorrhage or brain tumors. And this is a white shadow and like star pack. This is the CT scan of the subarachnoid hemorrhage, like this. And what is this? Completely black. This is completely black. The word used is the hypodense. Hypodense may be the infarction, maybe tumor, maybe abscess, depending on the history of the patient. Yes. Black, hyperdense were used for the white pathology. And two differential diagnoses. One is the hemorrhage and second is the calcification. Black means hypodense pathology and the differential diagnoses are the infarction, tumor, abscess and infections. So this is the black pathology and the hypodense. This is mostly show the infarction and this is again on the one side. And look for this pathology, it is occur into the both sides. So when you are going to the peds ward and there is a child with a history of the birth asphyxia, you are seeing this type of a CT scan. This is a completely diffuse hypoxic brain injury. So whole brain is involved with the birth asphyxia or hypoxic. So white pathology is the hemorrhage. Investigations: blood CP, ESR, urea creatinine, serum electrolyte, blood sugar, drug level, lumbar puncture indicated, blood test, chest X-ray, urea, ECG, EEG, patient in the epilepsy, and finally CT scan and MRI. Management of comatose patient: identify and treat the cause, stabilize neck movement with cervical collar if suspected traumatic cervical injury, pass nasogastric tube, urinary catheterization and oxygen therapy. Indication of oxygen therapy: hypoxia, acute and chronic hypoxemia and silent symptoms of shock. Indication of ETT: endotracheal intubation, inability to maintain airway, failure to ventilate, failure to oxygenate, IV fluid, cardiogenic shock fluid, antibiotics, antipyretics, IV dextrose, electrolytes, anti-epileptic drugs if there is history of seizure, and steroids. To treat the raised intracranial pressure, head and elevate 45, steroids, osmotic therapy. If blood pressure is increased, antihypertensive and antidote. If patient is opioid poisoning, benzodiazepine, organophosphate, organophosphate. Subacute heparin for DVT, frequent postal change, physiotherapy and surgery. What are the indications of surgery? Cerebellar bleed, IV bleed, subarachnoid hemorrhage, massive cerebral infarction and brain tumor. Thank you so much.